It's big, it's bold, and it's not to be underestimated. The future of our health is going to be transformed, and it's going to affect you, me, and everyone. For the best part of 2 decades, I've covered the greatest innovation on Earth. I've been to space agencies, tasted future food, hung out with a load of robots, even been sort of turned into one. It involved an exoskeleton, and been invited to the moon. But this is the ultimate human story, and it needs to be told. Powering it is AI, not alone, of course, but alongside cutting-edge science and doctors. Yes, those actual human medics who are, don't worry, in it for the long haul. Since 1900, life expectancy globally has doubled. But healthspan, the years of our lives spent in good health, are not keeping up pace. And this is the story everywhere. In England, women are on average spending a quarter of their lives in poor health. For men, this is a fifth. We need to close this gap. It's not about living to wild old ages, but living better for longer. When I visited Loma Linda, the Californian blue zone where Seventh-day Adventists live, I was struck by how healthy they were. For them, it was a duty of religiosity to look after their bodies. It's one of those places on earth where people are living longer than average lifespans. And they're doing it through exercise, sleep, eating well. There was no great secret. I was waiting for 99-year-old Esther to finish at the gym, so it's impressive. We could all probably learn from them. But I spotted a sign in the lift that said only 3 walking frames at a time. So yes, they're doing well, but what's coming is a real superpower. That of foresight. That of being able to know when disease is likely to strike, so we can do something to prevent it or to find it early. At the heart of what makes this possible is patterns. This rather unexciting word that you might associate with Aunt Beryl's knitting is set to change the future of mankind, because AI can spot patterns that no human, not even Aunt Beryl, ever could. AI allows us to pull in data on lifestyle, activity, sleep, air quality, disease occurrence and more to better be able to predict cancer, heart disease, type 2 diabetes, so many other conditions. AI is of course not new, and it's not just one thing. Even in healthcare right now, it can be an extra pair of eyes on a scan, helping spot tumours. It can help a doctor take notes so that they can have the more human interaction. It can also look at micro movements in the face and gaze patterns to quantify depression. This is being trialled in the UK's National Health Service now in perinatal women, a group who are at high risk of depression. But what most experts believe is going to bring the biggest change is what's happening in cancer, in both diagnosis and treatment. And this is because there are so many variables. There's the genetics of the tumour, the location of the tumour, the stage of the cancer, the genetics of the patient, even their microbiome. Blood tests will increasingly screen for multiple cancers, and more targeting screening campaigns will find more cancers earlier, meaning that they can be better treated, more successfully and more kindly. I've already seen various trials where they're digging out these cases that might otherwise have not been spotted in high-risk groups. So, for example, in smokers, looking at CT scans of their lungs to try and find small tumours that could have been missed by humans. Also, for those who've been diagnosed with type 2 diabetes, to screen them for pancreatic cancer. They're a high-risk group for a cancer with low survival rates. Vaccines, immunotherapy, AI drug discovery, and AI-powered, more personalised treatment are all coming. They mean that we're going to be able to target the tumours harder whilst hurting the patient less. Every oncologist that I spoke to said cancer isn't hard to kill. The challenge is treating a patient in a way that is tolerable and killing the cancer. The medics, those oncologists, those radiologists, they're not going anywhere. They're a crucial part of the picture. AI is augmenting them. It's allowing them to have the right information in front of them at the right time. Being able to pull in data on previous appointments, family history, blood tests, and more, giving them the essential bits of information they need an appointment. No human could hold all of this information in their head at once. Research is also going into ways of being able to better predict recurrence risk. This is being done in women in breast cancer in Paris. The idea is that many people are having potentially more treatment than they need. So this can help people make those difficult decisions about what they want to do. And why are so many people in their 20s, 30s, 40s being diagnosed? AI is going to give us the power to understand more about what we're looking for and when. At the heart of this is data. Data is AI's fuel. It needs to be good quality, it needs to be fit for purpose, and it needs to be uniform. But this is all about data. In 2003, it cost $3 billion to sequence the first person's genome. That was part of the Human Genome Project. Now, any of us could do it ourselves for a few £100 with a postal kit. The question is how useful that information is, because it's all about actionable data. There's only a limited amount that science knows now, and we might be completely overwhelmed by those results that we got back. But in time, we're going to learn more. More is going to become actionable. And we're going to be able to use genome sequencing as a way of understanding how medicines are going to impact individuals, also understanding more and more about disease risk. The power is huge. Already, Genomics England is sequencing the genome of 100,000 babies. These are babies considered to be at risk of rare disease. Rare diseases are actually fairly common because there's a lot of them. And in some cases, finding them early enough means that they could, for example, avert blindness. It's something actionable. If you were told you were going to die at 50 and there was nothing you could do about it, you probably wouldn't want to know. But if you were told you were going to die at 50 and there was something you could do about it, the chances are you would want that information. There is plenty that we can already start to do to help ourselves at a basic level. Think about these wearables for a start. They're just one example of a way to collect a lot of data on ourselves. Now, yes, they can motivate you to do a bit more exercise. You can keep track of what you've been doing. But I think there's something far more important going on here. And it's about those patterns. You can also see how your body's reacted to any changes that you've made. But you can see the baseline for what your normal is. They're not medical devices. They're not for diagnosing. But you can see when the patterns change. And there have been numerous cases of people seeing that something is amiss and going to see a doctor for further diagnosis and finding out that they have heart conditions or even cancer. Changes can mean nothing, but sometimes it's really useful and important information. It's been recognised that sleep patterns change 20 to 30 years before dementia symptoms start. So if we knew what we were looking for in this data, well, it gives us a chance to do something. You might wonder what? Preventative drugs are going to get better and more targeted. We're also going to understand more about prescribing lifestyle and exactly what impact these lifestyle changes have. And as more time passes, there's even more data that we can add to this picture, whether it's a saliva test for cortisol levels, a continuous glucose monitor in your arm, or even just the air quality around you. All of this information plays into your health, and we now have the power to be able to pull it all together. But we mustn't lose sight of the target. Back in Loma Linda, I also met 103-year-old Mildred. She was what you would describe to be in pretty good health. She had no obvious disease. She was of sharp mind, but she'd simply had enough. Her daughter had died 30 years before. Her son was bedbound. Every time she stood up, she was nervous she was going to fall over. And even in this community where there were plenty of things to do, there were lots of get-togethers, there were visitors, but she didn't know exactly when someone was going to come to see her next. She'd had a very successful career. She was a doctor, and she'd set up hospitals in Africa. What she felt was missing now was purpose. She didn't recommend this age to anyone. So what should we be asking the AI to do? Sure, to keep us alive, but also to keep us in the state we want to be in, to carry on feeling fulfilled. It has the power to close the gap on healthspan and lifespan. It can, as many experts put it, change us from a system of sick care to one of healthcare. And done right, and this is crucial, it can do this for everyone. It won't be perfect. It's not going to happen overnight. And we need to make peace with the data that we're handing over. We also need to do our bit. Lifestyle is going to play into it. But as Mildred said just before I left, yes, lifestyle's important, but it's not just about staying alive. We've also got to live. Thank you, Mildred. Thank you to you.